Hello anatomy students, this is Rob Swatsky, and we're continuing our screencast review of the appendicular skeleton, looking here at the patella, or kneecap, the anterior covering of the knee joint between the femur and tibia. The word patella means little plate, and that's basically a good description of the shape of the patella bone. It's a thin, flat, circular, plate-like anterior cover. And its shape is very triangular or seed-like, and in fact it's a type of sesamoid bone, one of these irregularly shaped bones of the body, like a sesame seed. Notice the top superior portion of the patella is very flat. We call that flat region the base. Base is at the top, not at the bottom. At the bottom we have a pointed inferior apex. We use the same type of terminology to describe the shape and orientation of the heart, flat superior base, and the heart's inferior pointed apex. When we flip the patella over to the posterior surface, we can see the points of articulation between it and the distal lateral and medial condyles of the femur. If we look closely, we can see two small circular flat regions. These are called the articular facets. Articular, articulate, means to move here at this joint. And facet, we know, means a flat face or flat surface, just like the terminology we use to describe the flat regions of the processes of the vertebrae as they glide against each other. The two articular facets here on the posterior patella correspond to the lateral and medial condyles of our distal femur. The smaller of the pair is the medial articular facet, and the larger of the pair is the lateral articular facet. We can also see a little region here at the inferior apex of the patella that is an attachment point for a ligament that's going to insert onto the tibial tuberosity. If you run your fingers down your patella and you come to that bump on your tibia bone, that is the tibial tuberosity where this ligament is inserting and attaching. And speaking of ligaments and a point of attachment between bone and bone, let's just hop back to the femur. Remember, the head of the femur is oriented in what direction? Medially. So we're looking here at this medial perspective of the head, and notice this little dimple. This little dimple is called the fovea capitis femoris, where the word fovea means a little pit, this little cavity on the head, capital, capitis, head of the femur bone. And the ligament that is attached here is holding the femur strongly to the acetabulum of the coxal bone. We also see our neck of the femur, and this structure is the lesser trochanter. Remember, the lesser trochanter has a more medial orientation with the femur's head compared to the lateral orientation of the greater trochanter, which we can see a little bit of that here on the far side of the bone.